Even the best signal can't work well in a broken system. And that's when I realized if we want PRP to truly perform, we have to prepare the body to respond. So if you're a doctor, think of this as evolving your toolkit, another tool in your toolkit. If you're a patient, think of it as taking control of your body's ability to heal. You've heard of the power of platelet-rich plasma, or you've seen how it works. What if I told you it's only scratching the surface? What do you think would happen when we supercharge it with the right support therapies? The results will surprise you. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. We all know platelet-rich plasma is the cornerstone of regenerative medicine. But what most people don't realize is that PRP doesn't act in isolation. Its success depends on the environment you put it in. I'll show you how optimizing the body through the right support can take PRP results from good to extraordinary.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.
So why does PRP work better for some patients than others? When I first started using PRP, I was amazed. You're using your patient's own blood, concentrating the growth factors, and putting them exactly where their body needs it to heal. PRP signals regeneration. It's the own body's repair kit. But here's the thing. Even the best signal can't work well in a broken system. And that's when I realized if we want PRP to truly perform, we have to prepare the body to respond. And I've seen this so many times. Two patients with the same injury, same PRP protocol, with very different outcomes. One recovers fast and the other doesn't. So what's the difference? Well, I'm here to tell you, it's not the injection. It's the biology behind it. If the patient's hormones aren't balanced, if the chronic inflammation isn't managed, if their nutrition is not optimized, PRP can't do its job effectively. It's like planting seeds in dry soil, or it just doesn't work well. So that's when I started combining PRP therapies with other therapies that nourish the terrain so that the healing signal of PRP actually takes root. So what can you combine with PRP to supercharge it? Let's talk about what that looks like in practice. Number one, hormone optimization. So hormones like testosterone, estrogen, thyroid hormones, growth hormones, they all play a critical role in tissue repair and inflammation control. When these are out of balance, recovery slows and fatigue or chronic inflammation can reign. By restoring the hormonal balance, we help the body respond more effectively to PRP's healing signals. So it's not just about more hormones, it's about the right balance so that the body's repair mechanisms can actually do their job. Next, nutritional support. So clearly, nutrition is the foundation of regenerative repair. PRP just provides the growth factors, but your body still needs the raw materials, proteins, micronutrients, vitamins, minerals, antioxidants to rebuild tissue. So when the patient's diet is not optimized or their gut health is compromised, the healing signal from PRP doesn't have the resources it needs to work. Optimizing nutrition, reducing systemic inflammation, and improving gut health ensures that PRP can perform at its peak potential. So I don't use these therapies to replace PRP, and clearly PRP can't replace poor nutrition or lack of raw materials. I use these to elevate what PRP can do, to create an internal environment where the healing isn't just possible, it's inevitable. So by combining these supportive therapies, we're not just treating an injury, we're transforming the body into a system that knows how to repair itself efficiently and sustainably. I wanted to share a quick story with you. One of my patients, she's a competitive runner, came in with chronic Achilles pain, and she had tried everything: physical therapy, rest, ice, even topical cortisone, anti-inflammatories. We decided finally to do PRP. But what else did we do? We balanced her hormones. We gave her nutrition guidance, and we added shockwave. So within weeks, she wasn't just healing, she was thriving. And that's when it hit me. PRP works best when the body is primed to receive it. So PRP is not just a standalone magic bullet. It's the foundation of a broader regenerative strategy. It's not just about treating more, adding more treatments. It's about creating synergy. And when we combine it with the right support therapies, we're not just treating injuries, we are restoring health from the inside out. So if you're a doctor, think of this as evolving your toolkit, another tool in your toolkit. If you're a patient, think of it as taking control of your body's ability to heal. If you found this helpful, don't stop here. Subscribe to my YouTube channel for more insights on regenerative medicine. And join my newsletter for deeper clinical strategies, case studies, and behind-the-scenes updates from my practice. Because when we understand the science and honor the body, we don't just treat injuries. We help people reclaim their lives.